let's discuss Brugada Syndrome. Hey everyone, and welcome back to Quick Medical Review. In this episode, we're talking about a condition that, despite being relatively rare, holds significant clinical importance due to its association with sudden cardiac death, called Brugada Syndrome. We'll be discussing pathophysiology, diagnosis, clinical features, and most crucially, how to manage it. So, if you're a medical student, clinician, or healthcare provider, stick around. This episode is for you. Now, what is Brugada syndrome and why does it matter so much in clinical practice? Brugada syndrome is an inherited heart condition that affects the way electrical signals travel through the heart. It's classified as a cardiac sodium channelopathy and is linked to mutations in the SCN5A gene, the same gene that's also implicated in other cardiac conditions like long QT syndrome. But here's the key point: unlike many other cardiac conditions, the heart is structurally normal. However, don't be fooled by the idea of a normal heart on imaging. Patients with Brugada syndrome are at a significantly increased risk of life-threatening arrhythmias, particularly ventricular tachycardia and ventricular fibrillation, both of which can lead to sudden cardiac death. This makes recognizing the condition absolutely critical. Brugada syndrome was first described in 1993 by the Brugada brothers after observing a group of patients with recurrent episodes of sudden cardiac arrest that couldn't be explained by any other heart disease. Since then, our understanding of the condition has grown, but there's still much to learn. Now let's get into the core content. We'll cover 5 key areas: etiology, pathophysiology, clinical features, diagnosis, and management. Brugada syndrome has traditionally been thought of as an autosomal dominant genetic condition, but recent research has shown that it's more complex than that. While mutations in the SCN5A gene are the most well known, other gene mutations are also implicated. In fact, only about 20% of patients with Brugada syndrome have an identifiable mutation in the SCN5A gene. Interestingly, it's now believed to have an oligogenic or polygenic inheritance pattern, meaning that multiple genes, not just one, may influence the condition's severity. Let's discuss pathophysiology. Here's where things get technical, but I promise I'll keep it simple. The problem lies in the function of sodium channels in heart cells. The Nav1.5 sodium channels, encoded by the SCN5A gene, are responsible for the initial phase of heart muscle depolarization. When these channels don't work properly, it leads to slower conduction of electrical signals in the heart. Two main theories explain how this happens: repolarization disorder hypothesis and depolarization disorder hypothesis. Repolarization disorder hypothesis suggests that some areas of the heart repolarize too quickly compared to others, creating an electrical imbalance. Whereas depolarization disorder hypothesis suggests there is a delay in the conduction of the signal, particularly in the right ventricular outflow tract, which is why we see the distinctive ECG changes in V1 to V3. Either way, the end result is an increased risk of dangerous arrhythmias like polymorphic ventricular tachycardia and ventricular fibrillation. Let's discuss how does a patient with Brugada syndrome presents. Two-thirds of people with Brugada syndrome are asymptomatic. This is why it's often discovered during family screening or routine ECG. However, some patients will present with syncope or fainting due to a transient arrhythmia, unexplained cardiac arrest, usually during sleep or rest, unlike hypertrophic cardiomyopathy, where cardiac arrest usually occurs during exertion, atrial fibrillation at a young age that is less than 30 years old, nocturnal agonal respirations, essentially gasping for air at night. Certain triggers can unmask Brugada syndrome, such as fever. It's crucial in pediatrics. Certain medications like antiarrhythmics and anesthetics, excessive alcohol consumption, and illicit drugs, especially cocaine and cannabis. Diagnosis hinges on recognizing a characteristic pattern on an ECG, specifically in leads V1 to V3. There are 3 recognized ECG types, but type 1 is the only one that is diagnostic. Type 1 shows a coved ST segment elevation and a negative T wave. The diagnosis can be supported by the Shanghai score system, which takes into account clinical features, family history, ECG findings, and genetic testing. Sometimes a drug provocation test using a sodium channel blocker is performed to unmask the ECG changes. Now coming to treatment. The ultimate goal of treatment is to prevent sudden cardiac death. This includes lifestyle advice, pharmacological management, and interventional management. Lifestyle advice includes avoid fever, certain medications, illicit drugs, and heavy alcohol consumption. Pharmacological management includes, in some cases, quinidine is used to reduce arrhythmias for interventional management. The gold standard is the implantation of an implantable cardioverter defibrillator, especially in those with a history of cardiac arrest or sustained ventricular tachycardia. Family screening is essential, and first degree relatives may undergo an ECG or a drug provocation test to detect latent cases. So, how can you apply this in your clinical practice? First, keep a high index of suspicion when you see unexplained syncope, especially if it occurs during sleep or rest. Don't just blame it up to vasovagal syncope. Check the family history for sudden cardiac death in relatives under 45 and always get an ECG. For patients already diagnosed with Brugada syndrome, education is key. They should be aware of the lifestyle changes they need to make, like avoiding fevers, certain drugs, and excess alcohol. As a healthcare provider, you'll be the one explaining this to them. That brings us to the end of today's episode on Brugada syndrome. I hope you feel more confident in recognizing, diagnosing, and managing this potentially life-threatening condition. If you found this episode helpful, please follow, rate, and review the podcast on your preferred platform. Your support helps this content reach more medical professionals like you. And if you have questions, comments, or topics you'd like us to cover in future episodes, drop us a message. Thank you for listening to Quick Medical Review. See you next time.